Hello, viewers. This is your host, Israr Kasana. Today, we are going to talk about Alberta. And you know why? Because of the economy, politics, COVID, and now Omicron. So, as you all know, that fall session of Alberta's legislature has just ended. There has been a lot of activity reported in that session. To talk about that and other important issues related to Alberta, we have with us none other than the Premier of Alberta himself, Premier Jason Kenney. So we will talk about Alberta with Mr. Premier. Mr. Premier, welcome to the show.
Thank you so much, Israr. Great to be back. Assalamu alaikum.
Walaikum assalam. Thank you very much, Mr. Premier. It's always a pleasure to have you. So, as I was talking about the legislature, and the fall session, it just ended. Uh, I remember, you were sworn in on April 30th, 2019, as 18th Premier of Alberta. In early 2020, we were hit by the COVID, and it was a big challenge. Today, how confident are you? Are we better off than the previous year when I interviewed you exactly a year ago?
Yes, we're better off on COVID and much, much better off on the economy.
Mhm.
We are closing out 2021 with COVID numbers coming down. We've
Right.
crushed the fourth wave. Our hospitalization numbers coming down. And perhaps most importantly, our vaccine rates have gone way up. We are now at about 90% vaccine rate amongst adults in Alberta. And I know many of your
Right.
viewers are living in Northeast Calgary. I want to say to them, they've done an amazing job. They have the highest rate in the province. Well done.
Yes.
And that's helping to save lives and keep people safe. We also have new medications that will be approved and become used in the hospitals to combat COVID in 2022.
Right.
We can expect future waves. Hopefully, those waves will be smaller and the impact in terms of hospitalizations will be lower. That we don't yet know enough about Omicron, the new variant, but early data suggests that Omicron is quite contagious, but does not lead to severe outcomes like hospitalization. If
Right.
that is the case,
Yeah.
if that is the case, I think we can hope for COVID to begin to stabilize next year as we get on with our lives. On the economy, Alberta is leading Canada in economic growth. We have created 118,000 net new jobs so far in the first 11 months of this year. We are projected to be leading Canada in growth next year. Billions of dollars of new investments, a strong recovery for oil and gas, but also big diversification happening across the economy. Uh, Major new investments, petrochemicals, hydrogen,
Right.
film and television, digital, high tech, agriculture, agri-foods, renewable energy, and on and on. The parts of our economy being held back because of COVID continue to be hospitality, like restaurants, travel, and tourism. But once
Right.
they fully recover, we are going to be taking off like a rocket. Alberta will be once again that land of prosperity that many people came to.
That's great. That's great. But Premier, on a scale of 10, what is your confidence level?
For next year, I would say you're going to force me to a number. I'll say eight because
Eight.
there's a margin of unknowns about
Mhm.
COVID. We don't know what new variant might start somewhere,
Yeah.
but based on what we know now, I am very confident that it's going to be a good year in maintaining
Right.
this growth situation Alberta is now enjoying.
And especially, talking about the fall session, which started on October 25th, uh, the government introduced the Labor Mobility Act to knock down employment barriers and, as you mentioned, attract more skilled professionals to Alberta. And then, as you mentioned also about the large investments totaling $10 billion, which will add 16,000 new jobs. And especially the web sector also, Amazon is going to be there. So Alberta government is doing a good job, but as you said, your confidence level is at 8. But when we talk to the people, they think otherwise. Why is there is a discrepancy between the people's perception and the government's perception as well?
Well, a lot of uh, it's a very good question. A lot of the good news is going to take time to translate to every part of the province and be reflected in more employment. For example, Amazon Web Services, $4.3 billion investment in 3 huge data processing centers that will create
Right.
4,000 upfront jobs, 1,000 permanent jobs. That doesn't get started until late next year. The major petrochemical and multi-billion dollars, like 18 billion in petchem investments, those won't be shovels in the ground until about a year from now because of all the planning work that has to be done, zoning, regulations for the cities, and all of that, hiring people, training people. So there is a time lag, but I guess what I'm saying is we can expect a strong 2022 in the Alberta economy.
That's a good news, especially if the investments are coming back to this province. It's a great news. As you said, do we have exact numbers of micron, if at all, Omicron?
Come again? Sorry, I missed part.
You mentioned about the COVID, right? So the new variant, do we
Yeah.
have new cases here?
Yeah, we have so far, I think, 18 identified confirmed cases of the Omicron variant in Alberta.
Mhm.
None that have resulted in hospitalization. I would say, Israr, based on the early evidence coming out of Southern Africa, that it appears to be highly contagious, but without severe symptoms. It appears to be a milder version of COVID than the Delta variant, which currently makes up 98% of cases in Alberta. If
Right.
that's true, if that bears out in the future, it will be good news. Because if Omicron is more contagious than Delta, it will outcompete Delta. It will become the dominant variant. Eventually, Omicron could become nearly 100% of cases.
Right.
If it is more virulent, more contagious than Delta, but with far lower levels of hospitalizations and severe disease, then it's a good development. Back in
Right.
1918, the world was hit hard with the so-called Spanish flu. Tens of millions of people died. But eventually, by 1920, a contagious but mild version of that flu bug circulated around the world, and that's really what basically brought it to an end. I don't know if that's what Omicron will be, but I
Right.
certainly hope so.
And handling the COVID, Mr. Premier, you had faced a lot of criticism, even from within your party. And, we had a convention in last month as well, talking about your leadership. So people actually were questioning your leadership abilities. So why were, people criticizing you if the handling was okay, and
Well,
still it was
fair question.
providing results? Yeah.
Fair question. First of all, I we have not gotten everything right. We have made mistakes, and so has every government on the face of the earth. Every government has been learning
Absolutely.
about
Yeah.
how to manage COVID through trial and error. Alberta's COVID fatality rate, our death rate per person, is lower than Canada's, much lower than the United States, much lower than Europe's. And so I think in relative terms, we have done relatively well, but we've made mistakes as well. You ask about a political issue here, a political response.
Right.
Um, we have had a very polarized COVID debate in Alberta. We
Yes.
have some, generally on the political left, NDP, that wanted hard, constant lockdowns, shut down schools, shut down most businesses, lock people at home, and all of that. On the other extreme, on the hard right, you had some that wanted no COVID restrictions and are opposed to vaccines. Now, because my party is center right, we've taken a lot of criticism
Hmm.
from some of our more freedom loving, kind of libertarian style supporters who are
Right.
upset with me and the government for having, frankly, uh, 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 limited liberties and freedoms,
Mhm.
interfered in people's social, economic, and personal freedoms. That's something that I don't like doing. It doesn't come naturally to me.
Right.
I'm
Right.
I'm in politics partly because I believe in somewhat limited government. And so I think it's that tension that's caused some members of my party to get very upset with COVID policy, COVID limitations. And I get it. I understand why they're
Yeah.
upset.
Yeah.
But frankly, they shouldn't be upset with the government. They should be upset with COVID. We didn't invent it. We've tried to cope with it. Our
Yeah.
approach has been to use restrictions as a last and limited resort. But in terms of my party situation, Israr, I believe that uh, the vast majority of members in my caucus and party support my leadership in the general direction of the government. There will be a leadership review vote in
In
April
April.
of next year,
Yes.
which I'm
Yeah.
happy to have and to be accountable. And I'll respect the decision the members make. But I'm just doing my best to deliver on the commitments we made Albertans on jobs, the economy, pipelines, fighting for a fair deal for Alberta, and making life better for Albertans. And I think that we're starting to see those results now.
Very good. And you talked about the leadership review in April. Even the different constituencies, different constituent, organizations, 22 constituencies actually demanded to take place earlier, not later than March. So why people are questioning your leadership? If you know,
Again, I'll repeat, Israr, those are generally uh, that discontent comes from uh, people who are angry with the government imposing public health restrictions.
right,
Some of them are anti-vaccination people. Most of them are opposed to COVID-19 health restrictions.
right,
But as I said to my party convention 2 weeks ago, uh, if we had not taken some of these tough decisions, we would have run out of hospital beds for critical care. I
yes,
would have had to authorize pulling life support from people, denying others care. And I said to my party convention, I could not let that happen. We cannot let that happen.
right.
And that resulted in a standing ovation from over 1,500 conservatives
I
gathered
know.
in that hall. I think the vast majority understand the government has had to lead, although there are voices of dissent on that point, which I respect.
Well, that's fine. That's fine. Another opposition's criticism is on UCP's Bill 81, which they say that allows party members their memberships to be bought on people's behalf without their consent. Is that right?
No. There's never been an election law in Alberta that governs what parties do with party memberships. That's party business. And in my party, the United Conservative Party, our constitution says
Mhm.
that only individuals can buy memberships with their consent and they have to pay for it. It would be illegal under our constitution for others, third parties to buy bulk memberships. That's just ridiculous. This is an NDP distraction from what Bill 81 actually does, which is to get big union money and corporate money, big money out of Alberta politics. Until now, unions and others, well, in a lead up to the last election,
Right,
the unions spent $7 million in so-called political action committees to support the NDP and attack me and my party. Under this new law, you can only contribute up to $30,000 rather than
right.
millions
Yeah,
to a political action committee. We also have stopped the NDP's dishonest violation of election law, where they had the Alberta Federation of Labor spending millions of dollars on their behalf. We've also
right.
banned foreign money from coming into Alberta politics. We also brought in a clear fixed election date. These were all commitments we made to Albertans in the last election. We've kept the commitments, and I'm proud to have done so.
Okay. Talking about Lethbridge, 43,000 people, according to some reports, do not have a primary care physician, and none in Alberta's fourth largest city are accepting new patients. Are these reports, you know, well founded?
No, again, that's an NDP invention. Lethbridge has 100,000 people. The notion that 45% of the population don't have a family physician is ridiculous. It's true that the number of family physicians in Lethbridge has declined by about 25 over the past 4 or 5 years. But there is a strong effort to recruit and hire new physicians in that city. In fact, they're right now interviewing, I think, 9 family physicians for that place. We have more physicians working in Alberta than ever in our history, more nurses
Right,
working ever in our history. We are spending more tax dollars on healthcare than ever in our history. Under the NDP, Alberta's health budget was $19 billion. It's now $21 billion. We've added $1 billion to uh, do more surgeries and reduce surgical wait times. So, and Alberta has the most expensive healthcare system in Canada. Canada has one of the most expensive
yeah,
healthcare systems in the world. There is not a lack of resources. There is a need in some communities to do a better job of recruitment and retention of physicians. And we're working very closely with the city of Lethbridge and local partners there to do that.
So talking about economy, Mr. Premier, last two questions. Uh, I was just reading Sonia Savage's statement on curtailment policy today,
Yeah.
and the current curtailment policy will be allowed to expire on December 31st. Is this a good
Correct.
news?
Very. Now, this was a policy we brought in because we did not have enough pipeline access to export all of the oil we were producing,
Yeah,
which meant that we were massively underselling our oil. And in order to, so we had to bring in a policy to cap how much oil the energy companies produced, so we didn't end up with a huge backlog that drove down the price. Because after all, the oil belongs to Albertans. It belongs to all of us,
yeah,
not just to the companies. We give them the right to produce it, but we own the resources. Albertans, we have to protect its value, which is why we brought in those caps called curtailment policy.
right.
Now, since we completed the Enbridge Line 3 project, we're shipping almost 400,000 additional barrels every day. Alberta last month produced record high quantity of oil, shipped record high quantity at very high prices with a very small price discount. So we no longer need curtailment, thanks God. And should we complete the Trans Mountain expansion to Canada's west coast, that will actually further increase the price for Canadian oil. So I think we're looking at a bright future for that industry, which represents 1/5, 20% of
Yeah.
Alberta's economy and jobs.
Another important issue is the opioid crisis, Mr.
Yeah.
Premier. It's a very important issue, and Alberta government has a new weapon to fight that.
Yes, we have just launched the app. This is a wireless
Look at.
app that allows people who are using dangerous drugs at home, for example,
Right.
if they pass out, it will automatically signal to EMS 911 that
Right.
they may have overdosed. And so we've also announced that we've created 8,000 new treatment beds and spaces for people trying to recover from addiction. We're building 5 new long-term residential treatment centers to help people out of addiction. And yesterday, Minister Ellis announced an expanded opioid replacement therapy program that offers a benign, non-addictive kind of version of heroin that is not dangerous as a replacement as people move away from dangerous addiction to treatment and healing.
Okay. Final question regarding the education and curriculum. Uh, I was just reading Adriana's statement, also the Minister of Education, talking about the child abuse, about the some schools. So there is a lot of criticism on curriculum issues also. How would you defend that?
Well, Minister LaGrange will be addressing our proposed curriculum reforms next week. The goal of them is to reverse the decline in learning outcomes for Alberta students, particularly in math and literacy. Israr, many of your viewers are from new Canadian families who
Right.
immigrated here, and I think those their children often can be the most impacted by poor outcomes in things like math and reading. We need to make sure. And by the way, many lower income new Canadian families cannot afford private tutors or private schools,
Right.
and
Right.
they can only depend on the public schools. So we must have strong reading and math programs in the schools that equip children for success in the future. That's the core of our curriculum reforms. We are consulting, we'll be making changes based on the input that we get from parents, teachers, and experts. Minister LaGrange will say more about that next week. But today, our Education Minister LaGrange was talking about an outrageous situation where the Alberta
Right.
Teachers Union
Yes.
was aware of a gross case of sexual and other physical abuse of young children by a teacher. They did not take disciplinary action properly. They did not refer the matter to the police. It's not the only case where we have seen the ATA, the Alberta Teachers Union, effectively cover up and sweep under the rug very serious disciplinary issues. We've brought in a law just now to help us deal with that, and Minister LaGrange will go further next week to say
I think that there should be a zero tolerance
that
on
the
that,
Alberta
Mr. Premier.
100%. And that's what she's saying. So the union will no longer be able to regulate itself. That's a conflict of interest. We're taking firm action on that.
Absolutely. Are you upbeat for 2023? Any
Yes,
prognosis?
and 22. Both, we are going to be leading the country in growth. All of these investments are going to start to move next year. It's going to be exciting. Alberta is back. I'm looking forward to it.
I mentioned 23 because NDP is saying that UCP has to have a one-term government. That's it.
Well, Albertans at the next election will have a choice. Do they want to go back to the high tax, anti-business, low growth, economic disaster of the NDP, or do they want to continue with the strongest job creation and economic growth record in Canada under this pro-growth government? I think it's going to be a very clear choice.
Thank you very much, Mr. Premier. Wish you Godspeed, and may we see Alberta as the best place to live, not just in Canada, but the whole world. See you soon again.
Amen. Thank you so much, and happy Christmas and happy New Year to all of your viewers and listeners.
Thank you very much.